topic for today is functional vision assessment in clinical optometry. Today, we will move beyond visual acuity and refractive error to explore vision as a dynamic integrated system that supports learning, productivity, and quality of life across pediatric, adult, and the neuro-optometric population. By the end of the session, you'll be able to define functional vision from a clinical standpoint, recognize patients who require functional vision assessment, understand the core visual systems involved, and appreciate how these findings influence diagnosis, management, and referral decisions in modern optometric practice. Many patients we see present with normal visual acuity, say 6/6 or 20/20, and yet continue to experience headaches, eye strain, poor reading endurance, and reduced work efficiency. These symptoms significantly impact the academic performance, workplace productivity, and the overall quality of life. Functional vision assessment allows us to identify visual inefficiencies that increase cognitive load and remain undetected in the routine eye examination. So what is referred? What is functional visual acuity? It's how the eyes, the brain, and the visual pathways work together to perform real-world tasks. It determines how efficiently So what are the indications for these functional vision assessment? It should be considered whenever the patients report persistent visual discomfort despite optimal refraction. It includes individuals with learning difficulties, digital eye strain, post-concussion symptoms, developmental conditions, and those who do not respond adequately to conventional optical correction alone. So from a preventive care perspective, functional vision assessment is recommended as early as 6 months of age to support visual development. Annual evaluations in children are essential as academic demands increase, while adolescents and adults often develop functional stress due to sustained near work and digital device use, even with stable prescriptions. The core components of functional vision, they are built up of, like, say, 4 systems: the eye teaming, eye focusing, eye movements, and the visual perceptual processing. These systems do not function independently. Instead, they interact continuously, and dysfunction in one can compromise the overall visual performance. So let's look at the first one, which is eye teaming or binocular vision. So it refers to the ability of both eyes to align accurately and simultaneously on a common target. Efficient eye teaming is essential for single, comfortable vision and accurate depth perception. When this system is inefficient, patients often experience visual fatigue, suppression, or intermittent diplopia, particularly during near tasks. And poor eye teaming results in reduced stereopsis or the depth perception, spatial disorientation, and avoidance of near work. Clinically, we frequently see conditions such as convergence insufficiency or convergence excess, and basic phorias, or even vertical heterophorias, all of which can significantly affect the reading endurance and the visual comfort. The other component is eye focusing or accommodation, which is the ability to achieve, maintain, and adjust clarity at different distances. This system is essential for reading, writing, and prolonged digital use, and is closely linked with the Vergen system. Accommodative dysfunction often develops gradually and may be overlooked in the early stages. So patients with accommodative dysfunction may report intermittent blur, headaches, reduced attention, or difficulty copying from the board to book. And the symptoms typically worsen with fatigue or prolonged screen exposure and can significantly affect the academic and the occupational performance too. Eye movement skills include pursuits, saccades, and fixation stability. These skills are foundational for reading fluency, visual attention, and coordinated motor responses. Inefficient eye movements often result in slow reading speed, skipped lines, and reduced comprehension. In the real-world task, eye movement control is essential for reading accuracy, sports performance, and even classroom attention. Deficits in the system can mimic learning disorders such as dyslexia or attention deficits, and frequently are overlooked in standard optometric examinations. So why functional vision test is not routinely done? Usually it could be because it requires additional chair time, sometimes even advanced training and some specialized equipments. So as a result, many optometrists, they kind of refer the patients once they find a diagnosis to a specialized center. But I would recommend or highly advocate including these tests in your routine optometric examination. That's most important so that we don't miss on any early diagnosis. What's the structure of the functional vision assessment or examination? Typically, it is highly individualized, but it could include a pre-test, a detailed clinical examination, and an end visit consultation where findings are explained and management options are discussed. So what's a pre-test assessment? Basically, I would say even before we clinically start assessing the patient or a child, the assessment or the observation we make when the child enters the clinic or a patient enters the clinic, along with the history, that would include the pre-test assessment. And a clinical examination, apart from refractive status and ocular health examination, we need to assess the accommodation, including accuracy, amplitude, and flexibility, assess the eye alignment, which is vergence, forias, tropias, and ocular motility, which includes pursuits, saccades. Color vision and stereopsis should also be included, and that provides a comprehensive picture of the visual function. Perceptual testing also sometimes is important, and we can include this wherever indicated. It is recommended in complex cases such as developmental delay or brain injuries. It evaluates the higher order visual processing, including attention, memory, sequencing, form constancy, and it plays a key role in guiding multidisciplinary management. So the key take-home messages here are, in summary, the functional vision assessment explains visual symptoms that remain unresolved after standard eye examination. Normal visual acuity does not equate to efficient vision. By integrating functional vision testing into clinical practice, optometrists can provide targeted interventions, improve the patient outcome, and also position themselves as a primary provider of a complete visual performance care. Thank you, everyone.